With our sunny skies and comfortable temperatures, outdoor activities can come easy. But for those with debilitating knee problems, staying in is easier than going out.
I was having trouble walking, bending my leg, severe pain.
He was in constant pain, and then after his first knee surgery, he favored his other knee so much, trying to get the first knee back to be semi-normal. It put so much stress on the other knee that soon he had to have surgery on that knee as well. And the pain was excruciating.
Any medicine for pain at this stage?
Robert Satterley sought out board-certified orthopedic surgeon Dr. Greg Martin at JFK's Orthopedic Institute. Dr. Martin proposed a new cutting-edge procedure, partial knee resurfacing.
It's really the first surgery where implants are utilized that are made specifically for the patient. The actual patient goes through a CAT scan, and off of that CAT scan the implants are made. In addition, all the instrumentation utilized to implant those implants are also made off of that CAT scan. So the whole system from start to finish is specifically made for that patient.
This procedure rivals other knee surgeries in that the implants are designed to meet each patient's individual problem areas.
The knee really has three little joints within the joint. One, two, or all three of those parts can go bad. And what Conformis has done is come up with a very disease-specific approach. So if the disease only involves one side of the knee, you just address that side and leave the rest of the healthy bone and tendons and ligaments. If it involves two parts, then you replace those two parts and leave the remaining parts.
For Robert, enduring a second operation after already having a total knee replacement on his other leg came with some intrepidation.
The total replacement, the left leg, was very painful, before and after. My other leg was getting like the left one was. It was getting sore, couldn't walk on it. It hurt all the time. He said he could do a partial, which I'd heard of partial, but nobody ever told me about it. And he said it would take out just the bad part of the knee.
He had prior had a total knee replacement on one side, and when he presented he had pain in his other knee, and it was hurting him just really on the inside portion. When we investigated that, it looked like he really only had disease in one compartment. So we were able to go ahead and make his unicompartmental implant.
Through this customized approach, the path to partial knee resurfacing is quick. From the moment a person is diagnosed, a CT scan is performed to determine the size of the implants that are needed. Within 6 weeks, the operation is underway.
What we're going to be doing today is resurfacing that inside part of the knee with patient-specific implants.
With a surgical team in place, Dr. Martin and his staff insert the patient's individually tailored implants using small incisions.
Size is important when it comes to implants. This is one thing that we really know and understand now. If the implant's a little bit too small, it can sit on soft bone and it could potentially fail earlier. If the implant's a little bit too large, it can rub against these soft tissues, irritate tendons, and rub on the soft tissues and cause irritation and pain. As we all know, when we try on clothes, sometimes you're not a small or a medium or large, sometimes you're between the two. Maybe with clothes it doesn't matter, but when we're implanting an implant that has to survive for this patient for many, many years, we do know that size is important.
After the surgery came a rapid recovery for Robert.
The first operation, the pain lasted probably 5 months, a little better. The second operation was a partial, a month, and it was almost gone. It wasn't gone.
It is really pretty dramatic. He forgets a lot because prior to his first knee surgery, he couldn't move. His knee he was in constant pain. His recovery was so much better with the partial. It was really dramatic. In 1 week, he was still using a walker, but he didn't have to.
You did a good job.
Yeah, everything looks great.
Nearly 300,000 knee surgeries are performed in the United States each year. Dr. Martin encourages everyone to protect their knees and joints.
The first things I always tell people is you should always work on exercising, because if you have good strong muscles around your joint, it can support a healthy joint, it can support an unhealthy joint, and if you do need surgery, it's going to help your rehabilitation. The other thing that's really important is weight loss. I recommend that my patients lose weight if they're not near their ideal body weight, because the knee sees about 3 to 4 times your body weight with normal activities. So if someone were to say lose 10 pounds, it would be like taking 30 to 40 pounds off of the knee.
Since joint-related problems can be painful, the staff at JFK's Orthopedic Institute are devoted to making sure each patient receives comfortable care in a convenient environment.
We're in a separate part of the hospital away from the rest of the patients that is all orthopedic beds. And so the nurses are familiar with the patients. The physical therapists are accessible. Like there's a gym at the end of the floor that they can take you right down to. We're proud to be the only center of distinction for hip, knee, and shoulder replacements on Florida East Coast from the Joint Commission.
For Robert and his wife Melissa, it's this attentive care that's made life much more rewarding. Robert is no longer staying in, he's getting out.
Since the operation, I've got back to doing exercise, which I didn't do before. I ride my bike about 5-6 miles a day around Wellington where I live. It's a lot easier. I can walk more.
Since his surgery, he's almost back to normal. He can walk, he can do pretty much anything he wants.
To learn more about the Orthopedic Institute at JFK Medical Center, log on to jfkmc.com. Reporting for the Healthcare News Network, I'm John Bafar.